A patient presents to surgery and later dies of a heart attack afterwards. How can this happen? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law here in the state of Maryland, and I would like to talk with you today about a case study that I was reviewing. And in this particular case, what happened is an individual presented to an emergency clinic for a perirectal abscess, and because of this, the person was suffering from a lot of pain, had a fever, and was just really not doing too well. Well, based on all of this, the emergency clinic said, you need to go to the emergency room, and the patient was transported to the emergency room. While at the emergency room, the ER doctor took a look at everything and said that the patient needed surgery as soon as possible. But this is what the emergency room doctor noted. He noted that the patient was obese, noted that the patient was suffering from hypertension, and noted that the patient was a diabetic. Because of all of this, the ER doctor thought that this particular individual is a high risk for surgery. So the doctor ordered a lot of tests to be done and an EKG. Well, this is what happened. The next day comes and the patient is prepped for surgery. But here is the thing. The doctor doing the surgery had not gotten the results back from the EKG. So the anesthesiologist comes in and it gets the patient prepped, and the anesthesiologist also notes in their records that the patient is obese. The anesthesiologist also noted that there was some possible abnormalities with the EKG tracing. Even though all of this was present, the surgery went forward. Well, we fast forward to the completion of the surgery, and at the end, the patient suffered a massive heart attack. In a wrongful death lawsuit that was brought against not only the anesthesiologist, but also the surgeon who performed the procedure, the experts for the plaintiff all lined up and stated that in this particular case, the surgery should not have went forward because the doctors had not had the results back from the EKG and other tests. And what they stated was that this was a departure from the standard of care, not only for the surgeon, but for the anesthesiologist also. Because again, when a patient presents obese, hypertension, and things of that nature, this patient presented with high risk, and the surgery should not have been performed until all of the test results, a consult with the cardiologist and all the other doctors who looked at the other tests, until that was done. Now, why have I taken the time today to talk with you about this? Because more than likely, if you're watching this video right now, your loved one has died in a hospital, maybe in Baltimore, Montgomery County, Prince George's County, or somewhere in Maryland. More than likely, you're watching this video right now because you are concerned and you are confused about the process and you just don't know what to do next. This is what I invite you to do, and it costs you absolutely nothing to do this. Pick up the phone and give me a call. I can be reached at 301-850-4832. Or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer medical malpractice questions like yours all the time, and I'll be glad to listen to your story. If you're like a lot of our clients and a lot of individuals who contact us, right now you have a lot of confusion and there may be worry going on right now. Go ahead and give me a call, because as I explain the process to you, you'll have a better understanding, thereby reducing some of your worry and your confusion regarding the process. All right, guys, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.